All right. Can everyone see my PowerPoint slides there?
Yep, that's lovely and clear.
Lovely. Okay, good. So yes, today I'm going to be talking to you about our research project, which will be on peri-operative diabetes management. As Barney mentioned, that, and I'll talk in a little bit more detail in a moment, that covers the whole journey from before patients have their operation to during their time in hospital and afterwards, both on the ward and when they're back at home. And I'm Frances. I'm an anaesthetic doctor in the Wessex region. So I've been through a few of the hospitals in the region. I'm currently working at Poole, Bournemouth. So the outline of the talk, just a brief summary of what we're going to talk about. The study is being done by SPARC, and I'll tell you a bit more about who we are, why we're doing the study, what our plan is for the study in more detail, and then what we're trying to achieve. So SPARC stands for Southcoast Peri-Operative Audit and Research Collaboration. And essentially we're a network of doctors working at all these 8 hospitals in the Wessex region, from as far west as Dorchester up to Basingstoke, down to Portsmouth, and hospitals in between. We are primarily anaesthetic and intensive care doctors, so our research focus is in the operative period and also in critical care. And our aim really is, by collaborating together, we can do larger sort of multi-centre projects, which means we can get more data and hopefully draw more meaningful conclusions and make a bigger difference than just sort of being based at one hospital. Some of our previous studies that we've done in recent years include Fit 65, which was a project about operations in the older population. We've got another coming up on the treatment of anemia, but this specific project is about diabetes. So why are we doing the study? So national sort of statistics say that about 15% of all operations in the UK are for patients with diabetes. And that's quite a lot. And in general, studies show that they unfortunately have a longer length of stay in hospital and do have more adverse post-operative outcomes, meaning they might get some complications, and it just means that we're not quite treating them exactly as we'd like to, and there's lots of space for improvement. So our plan really is to follow the patient journey before, during and after their operation to have a look at what bits we can do better. And the National Centre for Peri-Operative Care actually released some new guidelines specifically for this 2 years ago, and they've been recently updated a few months ago as well. And they kind of pinpoint what we should be doing for people with diabetes undergoing both planned elective surgery and emergency surgery. So this is just an infographic of and I'm not expecting everyone to read all the tiny bits, but essentially just to give you a gist of the pathway of the patient and what we want to focus on. So both on the left, when the patient gets referred for surgery, and then all the way to before their surgery, hopefully a bit of optimization going on in terms of their diabetes, and then hopefully the plan's been made for before they're in hospital, up to when the day that they're admitted for the operation, through their time in theatre, the time on the ward, and when they're discharged. So it's looking at all these little points and hopefully putting them all together. So our plan is, for the study, we're going to have 3 to 5 enrolment days, and hopefully we'll have all 8 hospitals participating. And we're hoping to get probably around 100 to 200 patients during those 3 to 5 days, both type 1 and type 2 diabetes, having elective surgery in hospitals in the Wessex region. We thought we'd start with just planned surgery because this is our first sort of foray into this, and then potentially later on we can add emergency surgery as well. And we're going to follow patients from the day of admission and have a look back at what they had at the pre-op assessment, follow them throughout their theatre journey, recovery on the ward, and discharge as well. And that will involve both collecting clinical data and also patient questionnaires. So the sort of data we'd be collecting are things like demographics, so patient height, weight, medical history, their medications, whether or not they were given sort of the right advice about what to do with their medications when they're in hospital, whether their blood sugars were measured appropriately, and if they were too high or too low, if they were treated properly. Also what complications, if any, they had, and we're hoping to follow them up afterwards, the day after and on their discharge and at day 30. And then the patient questionnaire is just, we're hoping to catch them and ask them most likely on the day of just before their surgery, and also ask them at a time point after their surgery. And that might be on discharge as well with a follow-up phone call. And we're just refining the questions at the moment, but it would be things like asking them about what information they received before their operation, how they felt their diabetes was managed when they were in hospital, if they felt well supported after they left hospital as well. But this is sort of an area that we're hoping to sort of get some feedback on, and it'd be great to have a bit more of a chat about this. So some of the example questions we've got at the moment, it's hopefully going to be a simple tick box rather than sort of free text questionnaire. So hopefully quite easy to fill in. Things like, how confident do you feel managing your diabetes day to day? And then who would like to manage your diabetes whilst in hospital, whether that's the patient themselves or us or a combination. How they would rate the care that they received in hospital. And then on the right, whether anyone's discussed with them how to manage the diabetes before and after surgery, specifically the medications, and also the insulin, if they're on it, and how easy it's been to follow the information. So next steps. At the moment, we're still at a relatively early stage. So we've drafted a protocol, drafted a questionnaire and a patient information leaflet. But part of what we want to do now is really just get some feedback from the public, which is one of the reasons why I'm doing this today, and also going through ethics committee at the moment, because I think it's important to include the patient perspective, which we sort of debated for a while, but I think it's very important to know from patients themselves what they feel like we should be focusing on. And we're also in the process of getting some sponsorship. And what are we trying to achieve? Ultimately, we hope that our findings are going to highlight areas that we can work on, and we want patients to feel better prepared and supported before, during and after their surgery. Thank you. That's it. I'm happy to take any questions. It'd be great to hear your thoughts as well. And if you, either you or know someone who's been through hospital, have had surgery, that would be really interesting to hear about and know. Thank you.